It's really easy. Everybody needs to look good, you know, and be more beautiful. I mean, it's not only a way of being, feeling better with yourself. It's also a way of, as you were saying, they are afraid of plastic surgery, the common people, because they have no information on plastic surgery. But plastic and aesthetic is the same specialty, right? So with plastic and aesthetic, we use the same technique sometimes, plastic reconstructive to achieve some repair, big repair or small repair on the body or the face. And on aesthetic or cosmetic surgery, you know, you are okay. It means that your face is okay, you're not burned, you don't even have a skin tumor, or your eyes are not dropping, nothing is special, but you have this problem with aging of your face, for example, or maybe your neck is a little bit too fat, so you're losing a little bit of definition of your neck and jaw. So you want to improve something in your face, first to feel better with yourself, to feel more beautiful, and to look more relaxed. You know, it's so when you do perfectly aesthetic surgery, it's purely enhancement. It's never unnatural. Perfect, well done aesthetic surgery should always be very natural. So when you do perform on an aging patient, when you interrogate the patient, you question the patient, what they want. You know, sometimes when they are aging, they want to feel improvement. They want to receive some improvement, so it's not only to feel better, but also to get something better with their physical appearance. And for example, this lady, she really needed, when she reached 50 years old, she had been losing and gaining weight for 30 years in her life, and she really needed some facelift. And then after performing facelift, she wanted some more things on her breast, but then finish, halas, it was all that she was requesting to feel good with herself. So it's good aesthetic surgery should always be very natural. Maybe it can happen that the patient wants also a too spectacular result, and we can't compare movie star to a normal population. For example, in my patient here in Dubai, most of my ladies are or their mother having accomplished already 4 or 5 nice children, and they want to maintain and looks good for their husband, but looks good also for themselves. And a good part also of my ladies are also working. So they want to stay in adequation with their works and everything. So it's a different population. It's absolutely a normal patient, no movie star. When I have a movie star sometimes, because they feel the pressure of the TV and media, they want always to look as young as possible. But you need to adapt, you know, if you are over and they also start earlier. Most of the nice Hollywood actresses or even Bollywood actresses, you know, when they start to ask for facelift, they will be more 45 years old than 55. So they start earlier. But even when you start earlier, you can still achieve a very good natural result and appearance. But unfortunately, some of these ladies, they want to have too spectacular appearance, and they ask for more and more attention. That's why when they smile, it's too rigid. and it looks a little bit weird. But fortunately, most of our movie stars are still reasonable, and they're asking, like you and me, for natural results. So it's just depending the technique, you know. Sometimes when we perform a facelifting, and I do perform a lot of facial rejuvenation, non-surgical, because that's the tendency now. People, they don't want any downtime for surgery. They want to stay at work. They want to stay also to keep with their social life with the family and friends. So they want to be out of life for as little as possible. They want to stay on the track. So for these people, when I do perform a facelift or simply eyelid surgery to get rejuvenation of the eyes, you know, and make you look younger, I always tell them they just need 2, 3, eventually 5, 6 days off, you know, but not as much. If you're requiring spectacular surgeries, then maybe the convalescence will be more. But it depends on the technique and the technique you use. Most of my facelifting are very natural facelifting because patients are only, and many female patients of course, and also some men here in Dubai, but they want to have more younger, fresher look and appearance. They don't want to look strange. Sometimes some patient wants radical modification. You know, some American women want to have too high cheeks, and sometimes they want to change their face. So they require the nose and the chin and facelift and temporal lift. If you do cumulate the procedures in the same time, of course, the final result at the beginning looks a little bit unnatural. But most of the people are not requiring this type of surgeries. They are just asking for natural, good-looking surgery. And they get it. Some of these creams definitely are very efficient, and you don't need to spend a fortune. You have nowadays we have such a high competition with international brand of cosmetic. It can be Revlon in America, it can be L'Oreal in France, and whatever, you know. You have so many competition in the cosmetic market, and you can get very good cream, at least to moisture your skin, and also to protect your skin from the sun. So you get good cream with cheap price, middle range price, or very high price. When you reach for La Prairie, it's very expensive, but you can get a L'Oreal cream or Garnier cream for very cheap, or Revlon, or, you know, and then you have a middle range, which is Estée Lauder and so on. So I'm not marketing for anybody in particular, but in every country, and I'm sure you wouldn't say no to me, I'm sure in India also you have a lot of Indian product, I know some Japanese product too, some Chinese product, and most of the time in every country women can get really good cosmetic. I would recommend women and men also to at least to try to moisturize the skin, because with air conditioning, pollution, but especially the heat, we get a lot of dehydration of the skin. So it's really mandatory at least to moisturize the skin, and then also to protect from the sun. So you need to have a sunblock. I'm very relaxed with it, because me also as a personal level, I'm using for myself Botox and all the botulinum toxin, which are competitors to Botox, and I'm using also some fillers for my face. But I had also a facelift, so you see, it's nothing, it's in contradiction. You can have all the good, you need to benefit from everything which is valuable, and when you reach a certain age, of course it comes to you then you have too much skin laxity and you require some facelifting for your face, you know, and to have a nice neck and have a nice definition of your cheeks. But if you are younger, let's take an example, you are 35 years old, you don't need a facelift. You don't need, most of the time, you don't need an eyelid surgery. Maybe you need a nose job, maybe you need a rhinoplasty. And most of the time, the only things you will need in non-surgical facial rejuvenation will be a little bit of Botox, so it's botulinum toxin, here and here and here for the glabella. And maybe you need just a little bit of filler for your nasolabial fold. That's it. You don't need more. If you have hyperpigmentation, you need maybe some bleaching treatment, some bleaching cream and preparation, or some light laser to remove some of the pigmentation. But you don't need more. You're 35 years old. So every time I had written in Dubai an article on beauty at every stages, 20, 30, 40, 50, and over 60. And at every age, you have specific need. But also we are unequal in front of life, of God, whoever, and in front of also the fight of aging. Some women over 50 have beautiful face and they absolutely need nothing. And some women over 40, because only over 40 and something, because they have been losing a lot of weight, so maybe they have already skin laxity and they need some facelifting or they need some body lifting. Most of my patients in Dubai are more worrying for them and their children about obesity than about facial rejuvenation. But we will come to post-obesity aesthetic sequela because it's a big challenging surgery with very good result, but it's a long way. When you have a beautiful Arabic woman, you have to adapt. She needs to keep a sort of Arabic nose. If you do a little American nose to a woman, Arabic woman with a strong nose and with high profile and definition, you need to adapt. Your nose needs to keep something from your background. So perfection is always depending on your culture, background, and everything. If you're operating a black American and the person, man or woman, is asking for more tightening of the nose, of course you can do some tightening of the nose, but you will have to adapt also and keep something which fits the personality. So it helps to avoid too strange nose, you see. Michael Jackson was a fantastic actor, but his nose was a little bit too small at the end. Not only an actor, sorry, singer. But also acting on the scene, yes, a fantastic artist. But he did a lot of plastic surgery, and as a personal test and a personal point of view, I think at the end, his nose was a little bit too small. He should have kept a more personal nose. The only things my patient in Dubai and the one who are coming from Sharjah or Abu Dhabi, the only things they are concerned about are the scars. Because now I really try to explain and give good education and information to my patient. They all know that they won't have any cancer because they do plastic surgery in their breast. What is important is, of course, then if they have, a woman had 5 to 6 children and they have been giving the breast to all the children, especially for a long period, automatically the breast is sagging, and if the breast is sagging too much, I will have to do more than filling the breast. It's not only putting an implant in the breast, it will be probably, if I have enough volume left, I will have to do breast lifting. So it means that I will have to remodulate, to resculpturate the skin and the glandula. So it means that I will have some scar on the breast, most of the time around the areola, which we call commonly the nipple, and also some vertical scar. And most of the scars are becoming almost invisible after 2 to 3 years, but you have to wait. I mean, the scars are not invisible at the beginning, and it's true that in certain patients they keep a little bit of hyperpigmentation on their scar. So women are more concerned about the scar than breast cancer. They definitely know that they won't get any breast cancer when they do plastic and aesthetic surgery to their breast. But they, of course, especially for themselves, but also for the husband, they would like the breast to be without scars. So in certain cases, I'd use different techniques. So when I can put implants, I always hide the scar so we don't see the scar. Or when I can put some fat in the breast, because we can harvest the fat from the legs, for example, or the buttocks, and put some fat in the breast and give more useful and freshness to the breast, so the woman is happy. And it's good also for the couple. So all this surgery requires no scar. But of course, if I do a breast lifting, a real breast lifting, we will have some scar on the breast, which will become, most of the time, almost invisible after 2 years. But you have to wait 2 years. Breast augmentation with implants, the scars are not visible. Breast augmentation with fat, the scars are not visible. They are very, very little. Breast lifting or breast reduction, the scars are visible for 2 years. Definitely, we can do liposuction at any stage, but we need to have a very strategic approach. If you have a person who is suffering of hyperobesity, very severe obesity, maybe this person will need what we call bariatric surgery. Bariatric, which means that we do something on the stomach or we do some deviation, so not all the food will be digested. So we need to help the person this way. So we reduce the volume of the stomach, or we put a gastric lap band on the stomach. So like this, you know, the person is obliged to eat less. And eating less, the person is losing weight. So when we have very severe obesity, I recommend to keep this approach. If the person doesn't want to get this type of treatment, I can start with one very good liposuction and then another one liposuction, and then in the meantime we go on with diet, very proper diet. It means that it's not fantasy. We need to have, or whether the patient is well educated and she or he knows perfectly what he's authorized to eat or what he should avoid. I'm not saying it's totally prohibited, but what he should avoid to eat. And we can do the treatment, me and the patient only, but in most of the cases we need a nutritionist. We need somebody to help the patient to educate the way he's eating or she's eating. So we do, in the meantime, we do a big liposuction and then nutrition and other liposuction again, and then eventually body lifting. But when I say big liposuction, there's always a limit. It shouldn't overpass 10% of the body weight and especially of the body surface. That's why we don't do mega liposuction. We avoid. Because when you do mega liposuction, the patient is too confident that it should be first, the follow-up is a little bit more difficult. You feel more tired. And then also, well, it's more complicated. So it's normally you don't lipoaspirate or liposuct more than 10% of the body surface. It's one of the safest in condition that it's well done, and with a patient who understands what we do, and also a patient who is responsible. So if we do a very reasonable, even a big liposuction, but not overpassing the 10% of the body surface, we have almost no risk. And it's the procedures which is the most common in all the world. You have something like more than 2 million liposuctions going on all around the world. So you see, it's the most favorite and most popular required plastic surgery for patient and for doctor. It gives good result, but it needs to be well done, well planified, and also with a patient who understands that it helps to lose weight. But if you go on with excessive diet, you go nowhere. So it's no use to go for liposuction if you're not able to refrain a little bit on sweet and fat and you saw what we call carbohydrate and cholesterol. You need to understand that it will really help you if you also help yourself. In Emirati country, it's definitely the woman. But also, in France we have, and in Europe we have 30% of our patients who are male. And in Emirates country it starts also, but it's not 30%, I will say 10% for the moment. Yes, 10% of men. When it comes to surgery, definitely it needs to be a plastic surgeon performing surgery. It means then plastic surgery. Plastic surgeon because they are well qualified and trained in plastic, reconstructive and aesthetic surgery. So it's very important that it's not a dermatologist or it's not a general practitioner who is doing aesthetic. You can do, I can also, some of my colleague dermatologists are doing some injection, but you know, it's inject some of certain fillers and injection of Botox, but when it comes in surgery, it should be the plastic surgeon who are doing the surgery. It's really important that we work this way. It's like being, you know, an orthopedic doctor. Well, it looks easy to suck or vacuum some fat, but if you have a bone fractures and you need to go to a orthopedic surgeon, you're not going to go to your general practitioner. That's the same for plastic surgery. You need competence and qualification. I could give a lot of advice, but first you need to be happy. So happiness is something you cultivate and you decide to have or not have. Sometimes, of course, you're not lucky, but you know, happiness is the best way of struggling against stress. Stress is giving a lot of oxidation, a lot of unhappiness, and a lot of illness. So when you cultivate the sensation of happiness, then what can you do? You need to be also reasonable. It means that you need to treat your body and your face correctly. Treating your body correctly, it means that even if you are young, you shouldn't stuff yourself with cakes and not unuseful sweeties and candy. You need to know that you need to have a proper education, food education. It's really important, especially here in Emirati country. We see too many young children going for fast food in the evening instead of mommy cooking. And I want the mommy to cook. I think it's very important that in family children we see too many obesity in children being 4 or 5 years old, And this is totally unacceptable. So we need to really educate the family. So somebody is really cooking, they have real dinner at night, they don't go for fast food. Fast food is always full of sugar, carbohydrate, full of sauce, full of fat, and very little good protein. So it's really important that you feed your body well, and also you train. You need to train a little bit. It's true that here in Dubai also it's so hot. You're not inclined to walk, but walking is good. Beaches are fantastic. You can go walking on Friday morning on the beach, and it's a good exercise. And then also you need to take care about the way you hold your position, you hold your back, educate your children so they eat properly, they stand properly, they don't refuse to go to gymnastics at school. But I think we are on the way to get that. We are on the way because it's an evidence. The obesity problem is a big concern, especially for the government, and I'm sure the government is trying to do its best to prevent obesity, especially in young people. So now, slowly we're coming to education. Education of the public, education of children, of mothers, of family, so we keep people in good health. Because you see, it's a general statement, but plastic and aesthetic surgery, it's a way of prevention. In a way, you prevent obesity. Preventing obesity, you prevent diabetes, you prevent high blood pressure, you prevent hypercholesterol, and also you prevent aging too much. So everything is tightened. But when you do, it's very interesting. Maybe it will be my final comment. When you do a big liposuction on a fat woman who is diabetes and have high level of cholesterol, you will, because when you do liposuction, you remove some fat of the body, and sometimes a big quantity of fat, you will always improve a biological status considering diabetes and cholesterol. It means that after the liposuction, she or he has less cholesterol and less sugar in blood. So it's proved now, and scientifically proved. We made many studies, comparative studies. When you do liposuction, you improve the sugar in the blood and also cholesterol and triglyceride. So also the fat in the blood. So it's real prevention. But of course, it needs to be done in the proper condition and with education, nutrition education, and also support.